Hello and welcome, William. So good to have you here. Maybe you can tell us about your background. How and when did you decide to become a dentist?
So, my father was a dentist. He went to dental school, but he never really practiced dentistry. He went on to medical school. So, I've always been around healthcare my entire life, and I've been always exposed to healthcare professions. My mother was also a nurse. So, going into healthcare almost was part of my life. And the interesting thing about dentistry is that dentistry is very artistic and very scientific. And I was always good at math, but I was also always good with my hands. And having those two married together was just the perfect combination, and I found that passion in dentistry. And the story of me becoming a dentist is actually a little bit interesting because it was my older brother who was seeking a career in dentistry, and I actually just tagged along with him for a tour that he was taking of the local dental school, and I fell in love with it. And I said, this is what I want to do. So that was the moment that I made my final decision to move in the field of dentistry.
That sounds very interesting. Maybe we can have a look in your practice. What does a typical day look like?
So I have what I consider to be a more low volume practice. As an endodontist, there's a lot of different ways you can schedule your patients and go about your day. I like to take a lot of time with my patients to make sure that they fully understand what's going on with their circumstance and their situation, and also the risks and expectations moving forward. And the communication is one of the key things that helps us develop that relationship and the outcomes that we're looking for. So a day in my practice, a busy day in my practice I should say, would be just maybe 5 patients. Each of them scheduled for about 90 minutes, and within that 90-minute period of time, we're meeting patients for the first time, we're doing our intake, we're finding out what their concerns is, what their problem is, we're taking our imaging from traditional 2-dimensional imaging and a 3-dimensional scan, we're doing an evaluation, we're making a diagnosis, and if the patient requires treatment, we're doing the treatment in that same time frame. So regardless whether it's a maxillary anterior tooth with 1 canal or a mandibular posterior second molar with 4 canals, every patient's getting about 90 minutes, and that seems to be a pretty good sweet spot for us to get all of that done in that period of time.
And maybe we can have a look to your book. So, what is the topic of your book, and what are some of the key highlights in it?
So my book is formatted in a very unique way for a textbook because it's not a traditional textbook as in the sense of chapters and a bunch of texts. It's more algorithmic systematic flow charts. And what I want people to do is get in my mind, my thought process from the time that I meet the patient until the time we've made that diagnosis and understood whether or not this tooth is something that has potential to survive with endodontic treatment. Because the biggest challenge that we have with long-term outcomes is case selection. So if we can help people understand, first of all, what the problem is, and then whether or not that tooth qualifies for long-term survival is really the target goal, because it doesn't matter how well you've done your root canal if you've treated the wrong tooth or treated the wrong problem.
And what kind of audience you want to reach with your book?
So the audience is broad. There are people that are using my book as manuals for their clinical team. There are students that are using this book to help them understand the process of diagnosis, prognosis, and case selection. There are endodontic residents that are using it. And even if you don't like to do the root canal specifically or the mechanical process, the knowledge of the understanding of the problem is critical for success of the treatment planning of that full mouth case. Where does that individual tooth fit in that full mouth reconstruction? And that's the idea of this book. So the audience is anybody who is interested in dentistry.
That sounds so interesting. And you mentioned the students, so maybe you can have or give a little advice for our students, for our young people considering a career in dentistry.
So this is important, and this is something that I've developed over my decade of 2 careers, and something that was told to me very early on, and it all comes down to communication. You know, you can be a wonderful dentist, have great hand skills. You can train to have great hand skills. We can teach that, we can copy other people, but what you can't really teach is empathy and communication. So what you have to do is learn to listen. If we can learn to listen to what our patients are telling us, they're going to give us the answers before we even ask the question. So if we can communicate well with our patients is one thing, but as a specialist, I also have to communicate with my referring doctors. So we have to make sure that we're all talking and we're all communicating well together. So if I had to give one piece of advice to a dentist who's just learning is learn how to communicate well.
So communication is the key. I got this. And maybe you can tell us what or who are you looking forward to seeing at IDS in Cologne?
So this is a very special show. Not only is it the 100-year anniversary of IDS, technology is always advancing here, and IDS is where we see it first. What I'm most excited about here at IDS is the idea of artificial intelligence. Specifically, Dr. Sanders' Diagnocat is what I'm really interested in looking at, because it really marries well to the message of prognosis, case selection, and diagnosis, and I can't wait to check that out.
William, thank you so much for your time. It was a pleasure. I wish you all the best.
Thank you very much. Thank you very much for this opportunity. Pleasure's mine.